Hello, and welcome to Atrium Health's Behavioral Health, where we are doing our part to decrease the spread of COVID-19. Because of the patients we serve and daily schedules, it is imperative that our teammates and patients follow strict safety protocols to protect themselves and others. Teammates should be vigilant during this time, often suggesting hand hygiene, proper cough etiquette, and symptom management. Teammates will record and report any symptoms that patients display that could require additional testing and isolation. Teammates should always keep in mind, identify, isolate, and communicate any patient that shows signs or symptoms. Patients will not be forced to test for COVID-19. But patients who do not undergo formal testing will be treated as COVID-19 positive until they comply and produce a negative test. This is a very sensitive time for our patients, and the hope is that with medication, sleep, and trust in Atrium Health's behavioral health, that patients would agree to testing. Testing consists of a nasopharyngeal swab. Patients who are awaiting testing results or have tested positive for COVID-19 will be placed in single private rooms. If there are no single rooms available, a double room will be used as single occupancy. All other patients will be placed in double occupancy rooms, sleeping head to toe if the beds cannot be separated by 6 feet due to room size. Hand hygiene resources are available in bathrooms and provided by teammates, and patients are encouraged to use them often during their stay with us. Showers will be disinfected after each use. Patients who have tested positive for COVID-19 or are awaiting results will have access to a disunited bathroom to prevent the spread of COVID-19. Teammates will educate and direct all patients to the correct bathroom. Personal protective equipment, or PPE, is an essential component for stopping the spread of COVID-19. Masks are required for teammates at all times and for any patient leaving their room. Patients will receive a mask at admission, and it will be theirs to keep for their entire stay. If the mask is cotton, it should be washed with the patient's laundry. If the mask is a surgical mask, patients will receive a new one when theirs becomes soiled. When the patient is not using their mask, they should place them on a clean paper towel. Masks should not have metal pieces or ties. Ties can be cut shorter and tied to make ear loops. Educate patients and teammates to only touch the edge of the mask and keep touching to a minimum. For facilities that require patients to have a negative COVID-19 test prior to admission, masks are only recommended for restrictive interventions requiring physical contact between a patient and a teammate. Education on the do's and don'ts of using a mask should be given to the patient or communicated in group each morning. Social activities are an important component to healing, so our group activity rooms will remain open during this time. To promote social distancing, furniture may need to be rearranged and units may be split in half to ensure smaller group numbers. Single-use activities are encouraged during this time, and patients will get to keep any single-use activity they use during their group time. Patients who have tested positive for COVID-19 or are awaiting results will need to remain in their private rooms for activities, which can be facilitated by teammates. For mealtime during the COVID-19 pandemic, facilities should consider a transition to serving meals on each unit. Hand hygiene will be promoted before and after mealtime. If patients are sharing an eating area, the seating should be placed 6 feet apart to promote social distancing. Patients who have tested positive for COVID-19 will eat all meals in their private rooms. At Atrium Health's Behavioral Health Services, we believe in the importance of recreational activities. Our gym and outdoor recreation areas remain open for patients to enjoy, with modifications for safety during the COVID-19 pandemic. Performing hand hygiene before and after recreation time is critical. Sports and activities that require shared items should be avoided, and any equipment used during this time will be wiped down immediately after use. If a code blue occurs for a COVID-19 patient, special actions are required. Use your facility's shared notification of code blue, overhead page, or alarm. Minimize the number of staff in the room by using a 2-rescuer CPR method. The code team will consist of teammates who are N95 fit tested and may include RN, provider, and behavioral health technician. In addition to a protective gown, gloves, and eye protection, all responding teammates should wear an N95 mask covered with a surgical mask while CPR is in progress. Teammates that are not fit tested for an N95 mask may assist from outside the area. Teammates should consider placement of a protective sheet over the patient during CPR to reduce contact with the patient. If there is no advanced airway, use a bag valve mask with a viral filter attached until the medics arrive. We at Atrium Health's Behavioral Health are committed to keeping our patients and teammates safe during the COVID-19 pandemic. We hope you found this video helpful as we do our part to improve health, elevate hope, and advance healing for all.